Wondering what new meds are out there to help with depression? Confused about whether esketamine might help your clients? Hi, it's Brain Bites with me, Dr. B. I'm Jessica Beachkofsky, your friendly online psychiatrist. Let's dig in. Today, we're talking about the medication esketamine, known by its trade name Spravato, which was approved by the FDA in March of 2019, specifically for adults with treatment-resistant depression, and then later for major depressive disorder with acute suicidal ideation. But what makes it so special? Let's break it down. First off, Spravato is a nasal spray, so no pills here. But the real magic is in its active ingredient, esketamine. It's a form of ketamine, which you might know as a dissociative anesthetic. Researchers discovered it also has really fast antidepressant effects with significant improvements in hours or days as compared to our usual antidepressants like SSRIs, which can take weeks to kick in. For people with treatment-resistant depression, which consists of about 30% of all depression cases, this is huge. This could mean relief from debilitating symptoms in just hours or days. Now, Spravato isn't something any psychiatrist can prescribe to be picked up at the local pharmacy and take home. It's only given under medical supervision at certified healthcare facilities. Why? Because it comes with some side effects worth discussing. The most common side effects are dizziness, nausea and vomiting, increased blood pressure, sedation, and dissociation. After the treatment, patients need to be monitored in the clinic for at least 2 hours after each dose to be sure there are no lingering side effects and that they're safe to go home, but not drive until tomorrow, and perform other daily activities. And the scheduling of treatment for treatment-resistant depression can get a little complicated. There are typically 2 phases of treatment, an initial induction phase and a maintenance phase. The induction phase usually lasts 4 weeks with treatments twice a week and a goal of quick improvements in severe symptoms. The maintenance phase generally has weekly treatments for the next month, and after that, there may be a treatment every couple of weeks, depending on somebody's specific response. Let's get into the science. Spravato works on the glutamate system in the brain, specifically targeting NMDA, N-methyl-D-aspartate receptors. Glutamate is the brain's most abundant excitatory neurotransmitter and plays an important role in synaptic plasticity. Essentially, the brain's ability to adapt, change, and form new connections. When Spravato interacts with NMDA receptors, it leads to an increase in the glutamate activity in certain areas of the brain. This spike in glutamate creates a cascade of events that helps to strengthen synapses and promote neuroplasticity. Think of it as rebooting the brain's ability to recover from the effects of chronic depression. This process not only improves mood really fast, but also supports long-term recovery by helping the brain rebuild pathways that were impaired by depression. What's fascinating is that this mechanism is completely different from how traditional antidepressants work. SSRIs and SNRIs focus on increasing levels of serotonin or norepinephrine, which are important, but their impact on the brain's wiring is indirect and slower. Spravato's direct action on glutamate is what allows it to work so quickly and effectively for people who haven't found relief with other medications. So who might benefit from esketamine treatment? As a therapist, think about clients with severe, persistent depression who've tried at least 2 different antidepressants without much improvement. Or clients who may experience acute suicidal ideation and need immediate relief. Spravato could be really effective for them and is like nothing we've ever had before as an option. It's also worth noting that Spravato is usually used with an oral antidepressant, and of course should be part of a comprehensive treatment plan, including therapy and lifestyle changes. But you know Spravato can't be right for everyone. It's not recommended for people with aneurysms, AV malformations, or a history of intracerebral hemorrhage, and it's closely monitored due to a very rare risk of stroke or heart attack, and of potential risks like abuse or dependence. Open communication between therapists, psychiatrists, and patients is key here. This isn't a magic cure, but it can be an amazing tool when used thoughtfully. It's a sign of hope for those who feel stuck in their depression, and it shows how far we've come in understanding and treating mental health conditions. And for therapists, it's an opportunity to talk about innovative solutions for your clients. So why should you care about Spravato? Esketamine represents a major advancement in depression treatment. For those stuck in the cycle of treatment-resistant depression, it can offer real, measurable results. For therapists, it's a chance to introduce clients to an innovative therapy backed by science, providing relief where other treatments may have failed. Understanding more about this medication means you're really at the front of our mental health field. Hope your brain is full of esketamine goodness. No 2 hours monitoring period required. Be sure to grab more tasty tidbits at brainbiteswithdrb.com. Enjoy.